Welcome to the second lesson. Now, we're going to talk about Avanto's plans coverage. We can divide this into 6 main groups: wellness and preventive, routine, trauma, chronic care, serious, and terminal. About wellness and prevention. Avanto covers alcohol misuse screening and counseling, cholesterol screening for adults of certain ages or at higher risk, hepatitis B screening, rubella, tetanus, and others listed here. Keep in mind, Avanto covers all wellness and preventive services as required by ACA at no cost. This includes the MECs. In routine, minor infections, flu, strep throat, prenatal care, and more. Remember that Avanto covers this by paying copays for primary care physician visits. This includes MECs. The medical plans also cover 20 spinal manipulation, chiropractic care, and rehabilitation. Trauma, accidents and unexpected injuries. Take note, Avanto covers this by paying for urgent care and emergency care with copays and/or responsibility share. The MEC's plans offer this coverage in a limited number of use. The medical metallic plans offer comprehensive unlimited use for trauma with copays and responsibility share. Chronic care. This is for sickness that needs to be managed. For example, diabetes, ADD, fibromyalgia, and more. Avanto covers this by primary care physician visits and/or specialists by paying copays and/or responsibility share. Both MECs and medical metallic plans offer coverage for chronic care. About serious diseases. This is for chronic diseases that get worse or serious trauma that requires surgery or intensive therapies and diagnostics like MRIs, dialysis, and chemotherapy. Avanto covers this with specialists, copays, outpatient procedures, and hospitalizations. Most of the outpatient and hospitals require the deductible to be paid in full first and/or some responsibility share. Serious illness needs are not covered in the MEC's plans. And terminal. Serious disease that has become terminal. Care for relief and transition into hospice care for the dying. Avanto covers this with hospital hospice coverage, which most of the time requires a deductible to be paid in full first and/or some responsibility share. Terminal illness needs are not covered in the MEC's plans. Next, general health plans. Check out these terms to better understand Avanto's plan coverage. What is a copay? A copay is a flat fee that people pay on the spot each time they go to their doctor or fill a prescription. What is responsibility share or coinsurance? Responsibility share or coinsurance is a portion of medical cost that people pay when their health plan kicks in. Now let's define deductible. A deductible is the amount you pay each year for eligible medical services or medicines before your insurance plan kicks in. What is out-of-pocket? Out-of-pocket is the most you'll have to pay during a policy period, usually a year, for health care services. Here's an example to understand how it works. Sarah gets a Silver Plus from California. In January, she goes to her doctor to get all her checkups and immunizations. She pays nothing. During her wellness checkup, her primary care physician discovers a peculiar growth in her back and her skin, and the doctor recommends she get it checked out by a dermatologist or oncologist. In February, Sarah goes to a dermatologist and pays $40 copay for the visit. The bill for diagnostic imaging and laboratory procedures was $508. This category of care is subject to the deductible. She pays $508. In March, she gets the results and the biopsy comes out positive for cancer. The dermatologist refers her to an oncologist. She pays $40 copay for her visit. The oncologist recommends she gets the skin growth operated on immediately. The doctor schedules a surgery. The surgery cost is $3,085. Inpatient surgical procedures are also subject to the deductible. Sarah pays the rest of her deductible. $3,085 minus $1,242 equals $1,843. Out of the remaining $1,843, Sarah now pays only her responsibility share, which is 25% of $1,843. That equals $460.75. Sarah has paid her deductible and another $460.75. for a total of $2,210.75. In June, she gets her appendix removed. The total cost is $33,000. Sarah's responsibility share would be 25% of $33,000, $8,250. However, her maximum out-of-pocket is $6,700. Therefore, she pays $4,489. $6,700 minus $2,210.75 already paid for in deductible and responsibility share. For the rest of the year, if she gets any other procedure done, she would pay nothing. Because she is beyond her maximum out-of-pocket. The next year, the deductible and maximum out-of-pocket would be reset, and she would again pay $1,750 deductible and $6,800 maximum for the following year coverage. Now are you ready to take the quiz? Let's start. Remember, you'll need a minimum of 90% passing score to advance to the next section.